So I have dual backgrounds in both law and in integrative health on the support services side. And about 20 years ago at Cal Pacific Medical Center, okay, back here behind the podium, I like to be near you guys. We started to take a look at how can we integrate wellness and natural approaches to healing and stress resilience and stress reduction training as part of medical services. And that proved to be a really fascinating course of work with a group of physicians there, and caused me to think about how can we take the advances that have been made in psychology and the understanding in behavioral health on how we help people to build deep innate abilities to be more psychologically resilient. And in psychology, the concept of psychological resilience is well understood. It's something that we can measure with validated assessments.
Healthcare is ailing. Epidemic levels of stress-related chronic disease are taxing the system at unsustainable levels. But doctors don't have the time or the behavioral health resources to address the problem. Stresspal changes the dynamic, introducing an online program that gives doctors and their patients medical-grade tools to build resiliency and vitality. With a prescription, patients log in anytime from any device. The core of the program is an entertaining web series with behavioral health training embedded into a compelling story.
Lori, what are you doing in the janitor's closet?
I needed a trash bag.
Patients can customize the program, allowing them to identify their own stress reactions. And then, target real-life challenges with practical interventions. Guided meditations deepen the practice, supporting patients as they achieve health goals. Meanwhile, doctors can easily follow the progress with validated assessments, extending the doctor-patient relationship beyond the four walls of the practice, helping patients succeed. Stresspal unifies leading therapeutic models into a comprehensive approach that actually retrains the brain towards resiliency and flexibility. It's this pioneering approach, an add-on service accessed from doctors' websites in an affordable at-home experience that makes the program such a breakthrough. Stresspal. Discover resilience.
Okay, great, thanks. Okay, so we all know people, friends, family members who have any one of these disorders, and there are many others that are now considered to be stress-related. And it may be very surprising for you to hear that at this point, in studies that have been done, about 75% of all doctors' visits are for stress-related conditions, many of them chronic. So we have a real problem in medicine facing healthcare today of a chronic stress-related disease rise, over 125 million adults in America alone, and impacting healthcare. The other side of this is a lack of mental health resources. So when people come to the primary care physician, it's recognized that there are these behavioral health components to disease, but there's really an absence of medical grade tools that keep the clinician in the process, that utilize validated assessments and that have that HIPAA compliance feature. The other thing I want to mention here is that we also have learned in psychology that one of the key obstacles to compliance with healthy directives, like losing weight, becoming more active, sleeping better at night, is overwhelm and fatigue. So it's almost like a comorbid condition. You really need to help people with the stress component of their life. So what we're doing here is helping healthcare to succeed by building a new class of add-on services for primary care physicians and other clinicians to be able to prescribe right from their own practice website as a preventive care service. We're utilizing the best practices interventions that are well developed in psychology and that up to this point are sort of done face-to-face by those practitioners who are trained in it, which are too few and far between, and sort of paper and pencil. Online learning is very effective for learning stress psychological resilience. And let me say a bit about psychological resilience. This is more than relaxation or recovery from stress. Stress resilience, importantly, is about how the brain first responds to and perceives and reacts deep within the brain to perceptions in our world, whether it's something's going on at work, at home, in any aspect of our life. So what's involved in psychological resilience training is actually retraining the brain in how we perceive our world. And the stress response, which is a complex reaction, doesn't kick in. It's that stress response over time that has deep wear and tear on the body. So we're building this as measurement-based tools. Fortunately, in the last 10, 20 years in psychology, there's been very good validated assessments of measuring both psychological resilience, perceived stress, and so on. So I'll get a little bit more into this. So from the user perspective, this is a personalized program. We're talking about, this is about a 6-week, self-paced over 6 weeks. There's 18 sessions, very interactive, very much personalized to the individual user's health goals. And we utilize the tools that we know about from media, from television, film, and media to really deeply engage with compelling stories that embed the therapeutic interventions. So we've pulled together a terrific team. My co-founder and I started the company. He is a clinical psychologist and a domain expert in this area. I've known Jim for years, and he's consulted with me on other health education, social emotional learning products that I've developed. He has developed all the interventions. We've developed all the content for the series, and we have built with Jay Eisenstock as a new member of our team. We brought in this past year. Jay is a healthcare IT thought leader and executive. He was the national director for Aetna's Provider eSolutions and has brought together, facilitated, and delivered major contracts in the $120 million range in health IT. Together, we have built out all our data modeling for our product. Lou Frederick is our fantastic media person. He's an award-winning director and writer out of Los Angeles. Together with 15 animators, he and I co-produced the prototype, the early prototype that we have, and he will be on board to creative director. On the sales side, Tony Horwath is a leader. His company's sales focus in health industry direct sales, sourcing, co-sourcing. We're also looking at licensing opportunities here. And our two terrific MD advisors have been participating at every level in reviewing, and we've done reviewing the product. They participated in the data modeling, and we have also done extensive physician surveys as well as consumer surveys. So we understand a lot of aspects of the, oh, you want me behind here, don't you? Okay, thank you. All right, so let me give you a little idea of the flow of this. In our model, physician groups subscribe to Stresspal as behavioral health content that will exist as a link on their own website or a dedicated landing page. It's very easy onboarding with no or minimal upfront fees for the physician group. The physicians or clinicians prescribe, place an order for Stresspal to their patient. Joe, you've got high blood pressure. I want you to stay on your meds, but this is stress related. I'd like you to try our new Stress Resilient Now training program. I'll be monitoring your progress over the next 6 weeks and be getting your outcome measures. Joe logs on to the MD site and begins the program. The MD stays in the loop with the assessments. Stresspal is paid on a per prescription basis to Stresspal. We're talking about a low flat fee. We're looking at we're using our projections are on $25 per prescription. The insurance company or direct pay, depending on the practice policy. And there are existing procedure codes for this service, this add-on service. Our target market we're meeting an underserved need in primary care, particularly. We will be approaching physician groups, accountable care organizations, healthcare payer plans, and payers. Another opportunity is workplace wellness. But our target is really, this is designed by clinicians, for use in everyday practice. For that 75% of patients who doctors feel would benefit from a program like Stresspal. We've had very strong physician endorsement and interest to trial this program when it's ready. It's a large market, as you can imagine, and we feel we can get some of that market to really get this rolling and become the gold standard for behavioral health tools. Stress resilient now, psychological resilience is the first. There will be other titles once we really understand the next demand, like sleep, for example, or conflict in relationships. So just to summarize here and recap, we all know there's 10,000 wellness apps out there, 300,000, I think, health apps. Fewer than 1% of health or wellness products out there are medical grade. When we say medical grade, we're talking about the HIPAA compliance, evidence-based, validated assessments of progress, keeping the doctor in the loop on outcomes. We've also designed this so it's minimal physician time. We know how busy doctors are. There's no training required. Doctors can easily prescribe and very summarized, tight outcome measures provided to doctors. Now, I haven't gotten into this does generate new revenues for the physician practice. This is a billable add-on service. And maybe the next slide will give you some quick financial projection, mostly the top I want you to take a look at. If we were to have a physician group with 10 doctors who are prescribing, maybe there's 30 doctors in a practice, but 10 primary care actively prescribing. Doctors tell us that on average they would prescribe about 17 prescriptions per week, even though they may see 200 patients or 150 patients and feel that about 2/3 of them would benefit from the program. Actually, they'd prescribe about 17. Based on those numbers, the revenue to Stresspal from that group would be estimated at $200,000. The revenue to that same physician group would be approximately $800,000. That's on a $25 per prescription basis and approximately $100 back to the physician group for that prescription from either the patient or the insurer. So this is just a recap here of what we're looking to raise. We've done some initial seed round with that funding. We have created a prototype to show the patient-facing portion, a prototype, and how it works. So you can dig deeper. We are also have done the data modeling for this, which is a big piece toward our technology side. And we're very excited about that. We do have a number of physician groups that are interested to trial this when it's ready. The $750,000 that we're looking to raise, and we've raised a portion of this, is to complete the build. This is there's literally a team of 15 animators will be required over a period of about 6 months. We found a terrific team offshore. It would cost us all of that if we were using it in right here. We found a great team that we worked with on our prototype, and also the whole IT development, engineering, and bringing on the rest of the team that we need to launch it and get to our proof points in terms of outcome. Okay, so so completing our full program and getting the clinical trials and testing would be what we're using. It's about a 1-year runway and to get us to the A round. So we are pre-revenue right now. We do have all our content developed. We've got a fabulous team ready to go. And we're looking for introductions that you may have, you may know of health organizations that might be interested in trialing this when it's ready. I'd love to hear from you on that. We do have a presence on AngelMD, so you can take a peek at us there. And first, of course, feel free to talk to me afterwards. So thank you very much, and I'd like to open it for questions. Yes.
So is this a $25 one-time fee to the patient and then it's an extended period of time, or is that only for the first 6 weeks and then they need to be prescribed? And then also is this reimbursed by insurance or CMS?
Yes. Okay. So the question is, what is the how does the fee structure work to the? Well, I'll correct it. The fee structure work on the $25, for example, or yes, it is the subscription fee is paid by the physician group to Stresspal, and the number we're working with is $25 for access to the program by the patient for a year. So they have a year's subscription. They can go back and review it, they can utilize it, they can renew it when they're done. And yes, there are existing procedure codes for which this type of behavioral health, preventive care, self-management, training, service was already billed for. We do have a lot of data also on what consumers would consider a fair price to charge them and a no-brainer. Consumers are overwhelmingly motivated to purchase an online wellness tool that their physician recommends. And the no-brainer price is $65. The good value likely to buy is $139. So if it's a direct pay situation, we would be giving some recommendations to the physician group, but somewhere around $100. So you see there between the 25 and 100, there's a return on investment for the time, in the physician's time involved. But they'd be free to charge whatever they want or not charge at all. I'd actually like to get to a point where we see the payers pay the patient if they complete the program and get a nice bonus back on their health plan dividend. Because it's going to save, it's a benefit to all the health care stakeholders here. Patients, reduced health utilization is one of the benefits we see from brief resilience training. And so that reduced, patients' involvement in medical fees. Yes, back here.
So is this something that can be done by telehealth?
By?
Is this something that can be done over telehealth and still?
Oh, absolutely. This is an online tool. It's web-based. It will be mobile for any device. And absolutely, it'd be an excellent tool in the telemedicine field. For any clinician, whether you're in office or telemedicine, and whether you're in psychology or not, for a psychotherapist as well, this would be an adjunctive tool that you offer as an add-on service. Did I answer your question? Okay.
What do you use to measure improvement? I mean, is there any industry standard?
Yes, there are. There are a number of very well-validated measurements of stress and also of resilience, psychological resilience. I did not mention in my presentation that there have been studies of patients. 80% of patients presenting to medical care show poor stress resiliency. And we can build our resiliency about 25 to 30% in a brief resiliency program. So we will be utilizing the leading assessments.
So what kind of clinical trials are you anticipating? You said that you need to do some type of clinical validation with some metrics. I don't know what those would need to come out as to be able to charge. And if it was very good, I guess maybe you could charge more. But how many folks, how many patients, and what are you anticipating?
Okay, so the question is, what are we anticipating in terms of the clinical trial, size of patient population, what metrics are we looking at, correct?
And are there other tools that you have to compare yourself to? I mean, in terms of some type of placebo or other gold standard, what else do you have to show for efficacy to be able to build? That's
a great question, and I haven't been asked that before, and I'd love to have my co-founder here because he's really our researcher and has served on a number of NIH projects as a lead researcher. So I think that clinical, we haven't designed that clinical phase yet, but the assessments that we're utilizing would track progress and change themselves to show an improvement and a reduction in let's say, stress and improvement in resilience. Whether there are other measures that we would want to take a look at, of course we would want to take a look at reduction in office visits? Can we track changes in hospital admissions? These would be excellent to be able to track, and those were looked at in the University of Massachusetts study that was just concluded about 2 years ago, looking at over 1,700 patients, looked at that kind of metric. So not only changes in the parameters themselves, but health utilization parameters.